What if I told you that the single greatest invention in the history of medicine is currently destroying itself? Right now, an invisible clock is ticking. New data projects that between 2025 and 2050, nearly 39 million people could die directly because the drugs we rely on to keep us alive simply stop working. That equates to 3 deaths every single minute. We aren't talking about a new pandemic virus like COVID-19. We are talking about the return of the pre-antibiotic era, a time when a scratch from a rose bush, a simple sore throat, or a minor surgery could be a death sentence. We call them superbugs, and the terrifying reality is that our own miracle drugs are the very things creating them. This is the Antibiotic Paradox. Today, we're going to uncover how we accidentally engaged in a biological arms race we are currently losing, why the companies that saved the world are going bankrupt, and the sci-fi technology that might just save us from a medical apocalypse. To understand how much trouble we're in, you have to understand how broken the world was before the 20th century. For most of human history, infectious diseases weren't just an inconvenience, they were the leading cause of death. Take syphilis. In the early 1900s, it was endemic and nearly incurable. The treatment? Inorganic mercury salts, or arsenic. You heard that right. The side effects were often worse than the disease itself. You didn't just take a pill, you took a poison and hoped the bacteria died before you did. Enter Paul Ehrlich, a German scientist with a wild idea. He noticed that synthetic dyes would stain some microbes but not others. He hypothesized, what if we could create a chemical that hunts down bacteria like a heat-seeking missile, leaving the human host unharmed? He called this theoretical weapon a magic bullet. This was the birth of chemotherapy, using chemicals to treat disease. But finding that bullet wasn't like finding a needle in a haystack. It was like finding a specific needle in a stack of other needles. Ehrlich and his team didn't just stumble onto a cure. They synthesized hundreds of arsenic compounds. They failed and failed and failed until they reached compound number 606. In 1909, compound 606, later named Salvarsan, successfully cured syphilis in rabbits. It was the first true antimicrobial drug. But it was difficult to inject and had nasty side effects. We needed something better. We needed a true miracle. That miracle happened by accident in 1928. Alexander Fleming returned from holiday to find a mold contaminating his petri dishes. But here's the crazy part. Where the mold grew, the staph bacteria died. He called the juice from the mold Penicillin. Now, you probably know that part of the story, but here is the underdog story you likely haven't heard. Fleming couldn't purify it. He essentially gave up on it as a medicine. It sat on a shelf for a decade until a team at Oxford, Howard Florey and Ernst Chain, picked it up in 1939. In 1941, they tested it on a human, Albert Alexander, a policeman dying of a severe infection that started on his face. They injected him with their entire supply of penicillin, and it worked. His recovery was startling, but there was a catch. They didn't have enough. The mold was incredibly hard to grow. Desperate to save him, the scientists collected Alexander's urine, extracted the penicillin he had excreted, purified it, and injected it back into him. It still wasn't enough. The supply ran out on the 5th day. Albert Alexander died. It was scarcity, not science, that killed him. But the proof of concept was there. Driven by World War II, the US and UK industrialized production, turning a rare mold juice into the weapon that won the war against infection. By 1943, we had entered the Golden Age. So, how do these magic bullets actually work? And why are they failing now? Antibiotics generally attack specific targets: the cell wall, the protein machinery, or the DNA replication process. Penicillin, for example, stops bacteria from building their cell walls. Without a wall, the bacteria literally explode due to internal pressure. But bacteria have been fighting each other for billions of years. They have countermeasures. This is what we call the resistome. When we flood the world with antibiotics, we force bacteria to use these ancient weapons. Imagine a nightclub bouncer. Bacteria use efflux pumps to physically grab the drug and throw it out of their bodies before it can do damage. Or they produce enzymes like beta-lactamases that act like molecular scissors, chewing up the antibiotic before it can work. Or they simply change the shape of their internal locks so the antibiotic key no longer fits. Here's the scary part. We haven't discovered a new class of broad-spectrum antibiotics since 1987. We are in a discovery void. Why? It's not just science, it's economics. Developing a new antibiotic costs hundreds of millions of dollars and has a 95% failure rate. And if a company succeeds, doctors will put that new drug in a safe and refuse to use it, saving it for emergencies to prevent resistance. It's the only product in the world where the better it works, the less we want to sell it. This broken market leads to disaster. Take the company Achaogen. They did everything right. They developed a new antibiotic called plasmicin. It was approved by the FDA. And then, they went bankrupt in 2019 because they couldn't sell enough of it to cover their costs. The message to the pharmaceutical industry was clear. Antibiotics are a business dead end. We are now in a race against time. But we aren't defenseless. We have new weapons. First, Phage Therapy. We are rediscovering viruses that naturally hunt bacteria. These are living medicines that evolve with the bacteria. France recently authorized a personalized phage therapy platform for veterinary use, a massive regulatory breakthrough that could pave the way for humans. Second, vaccines. Prevention is better than a cure. A 2024 WHO report suggests that better use of existing vaccines could reduce antibiotic use by 2.5 billion doses a year. If you don't get sick, you don't need the drug. Simple. Third, the Netflix model. This is an economic fix. Countries like the UK are testing subscription models. The government pays a fixed fee for access to a new antibiotic, regardless of how many pills are used. This delinks profit from volume, encouraging companies to invent drugs that sit on the shelf until we desperately need them. The era of blindly bombing bacteria is over. We need to be smarter. We need to stop using antibiotics to fatten up livestock and treat viral colds. If we don't, that projection of 39 million deaths isn't just a statistic, it's a future reality. So, here is my question for you. Should governments treat new antibiotics like public utilities, paying for them like water or electricity? Or should we leave it to the free market and hope for the best? Let me know in the comments below. Thanks for watching.